I'm often asked that question, but the Federal Reserve, it has responsibility for maintaining, for fighting inflation, and at the highest employment possible. That's our dual mandate. So we get headlines for adjusting the interest rates and things like that. But we're also a bank regulator, and so in that capacity, we enforce the Community Reinvestment Act of 1977, which if you had a chance to see some of the research that Urban Institute did last year, the Community Reinvestment Act with some allied regulations like first-time homebuyer regulations for Fannie and Freddie and other entities amounts to about $400 billion being invested into communities every year. So we as a bank regulator are trying to sort of foster the ecosystem of how that money gets spent, so it's spent in the best way possible to improve low-income communities. So that's kind of why I'm here. I hope you all had a little bit of coffee, because I'm going to go in like 7 different directions, and I have like 8 minutes left. But like one thing I just wanted, and I was playing with my phone here a minute ago, and I didn't want to be rude, but what I was trying to figure out was when the Harlem Children's Zone got started. Does anybody know when, by the way? In the late 90s. Okay, so it's over 20 years. So just wanted to give just perspective on this purpose-built model that we've been discussing here for the 3 folks here on the panel. So the first of the purpose-built models was in East Lake, and every 3 years now, that school system, and they really focus on 3 areas, right? Mixed income housing in a place that was formerly all very concentrated poverty, quality schools, and wellness, right? With an overarching sort of organizer that the purpose-built folks call the quarterback. Here's one sitting here in front of you, right? And they, every 3 years, graduate more people, more low-income kids into college than have ever graduated from the Harlem Children's Zone dating back into the 90s. So they are hitting on a model that is working, and they're now in 50 communities around the country. And so I really encourage you to take a look at someone who's really turning communities into salutogenic, health-promoting places. It's the purpose-built folks. And I guess, and the thing that popped in my head, now I'm going to go in a totally different direction. Because the value of that is really, because this is really, when we think about harnessing the value, I'm just kind of obsessed about that. And how do you turn that into a business model? So I'm thinking a lot about that lately. And so before Queen Elizabeth knighted Michael Marmot, and he was a big international superstar, like all epidemiologists are, he was studying at Berkeley, where all good scholarship originates, and his professor, Lynn Syme, was a good friend of many of us, who taught us many of the things about social epidemiology. His project at Berkeley was really interesting, because he found that he was studying the Japanese American population in California and stress-related diseases that they were experiencing at a higher than average rate, right? And so we thought, well, this is interesting. Is there something about sort of Japanese physiology that is really contributing to this? So he did a control group in Japan, which had none of those diseases, right? It was 0. Much higher than average, much lower than the California average in Japan. The genius piece of his dissertation was he decided to look in Hawaii, in places where it was half Japanese and half non-Japanese, and he found the occurrence of these stress-related diseases at 50% the California rate. Mm-hmm. So there is something very powerful about that. We all remember the phrase that Robert Wood Johnson taught us a long time ago, that your zip code is more important than your genetic code for your health. But there is a real powerful connection in where you live and your health. And so Federal Reserve, we oversee these investments in low-income communities, things that the community developers really care about, things like overcrowding in housing, unemployment, poverty. We would do these series of conferences around the country, and we would try to bring together the folks that were worried about those issues in community development, anti-poverty work, together with the people focused on health. And we would do these heat maps, right? So we'd look at these neighborhoods that would light up overcrowding in housing, right? And then we would do heat maps on things like prevalence of childhood obesity or asthma or other chronic disease. Certain neighborhoods would line up. We've done this 50 times. The last time we did it was at the Federal Reserve Bank of New York in December, where we brought together these 2 sectors. And we find that we are working side by side, but we don't know each other. So this is so in that very first conference, and I'll come back to Len Syme, he said, those of you who design, finance, and build our cities are the most important health workers of our time. So we're trying to figure out how can we use that $400 billion to promote more health. How can we know that kids who go to college live 10 years longer than kids who drop out of high school, right? These guys are creating health, right? Neighborhoods are creating health. So we've got to figure out how to divert more money into there. So I'm thinking about, okay, how do you do that? So there's the $400 billion is on the table. We spend about $1 trillion on anti-poverty work. A lot of that is spent on things. It's not that we shouldn't spend it this way, but it's too bad that we do because, for example, we spend $90 billion a year on job training. I think it's great. If someone loses a job, you should train them to do another job. That all makes perfect sense. But if we had educated those people to their fullest extent, they graduated from high school with the skills they needed, you wouldn't have to train them again, right? If we spent the money on a purpose-built $90 billion on making sure that all those kids arrive at kindergarten ready to learn, that they graduate from high school, that they enter into adulthood with the tools they need to really thrive, that's going to create health. So I'm trying to figure out how we can start spending some more of that sort of downstream money on the consequences of living in poverty upstream. And then see, I told you we had some coffee because this is a big swing. I'm coming back in to the value part of this. I think about how public spaces create health and how that actually, I'm obsessing on who owns the downstream medical care cost risk for some of these places. And if you create neighborhoods and spaces that promote community, that promote connections, the biggest indicator for a senior's health is not their blood pressure, it's the degree to which they are socially isolated. The antidote to that is a public place that connects people. My friend Maggie Superchurch, who has the greatest name ever, and I thought she was a hippie, but she's totally not. It was Maggie Super married Bruce Church, so it's not that interesting, really. She says, why can I invest in a company that makes a pill that lowers blood pressure, but I can't invest in a neighborhood that does exactly the same thing, right? So how do you capture the value? How do you harness the value? You create spaces that activate community, activate connections, activate exercise, well-being, a sense of control over your future. That saves the system a lot of money. Now, how much money? So our president, you would be surprised. So Risa Lavizzo-Mourey, when she was head of the Robert Wood Johnson Foundation, did a back-to-back speech with my bank president, John Williams. So it was very interesting. The doctor got up and talked about the role of health in the economy, and then the economist got up and talked about health, right? And that was it was a really kind of out-of-body experience when I saw those back-to-back speeches. In his speech, and because Federal Reserve, we do a lot of fact-checking, nothing leaves that building without a lot of economists taking a look at it. He did this analysis. This is a few years ago, so these numbers are a little bit old, but he says basically $3.5 trillion a year spent on medical care. 85% of that is on chronic disease. Most chronic disease is avoidable. Most chronic disease that's avoidable is the byproduct of living in low-income, poverty, low-opportunity places. So he was speculating that there's about $1 trillion a year that we spend on, that we could be spending on creating spaces that activate all of those things that we know generate health. To buy those neighborhoods that Maggie Superchurch was talking about that make better, that are salutogenic and health promoting, and that there is a business model in there somewhere. I'll stop there.